Assalamu alaikum everyone. Hope you all are fine and doing great. Today we have our great speaker Dr. Naghman Zuberi with us and he will be discussing about the setting up of the teeth in the complete dentures and balance articulation, and it will be the continuity of the previous lecture, and this will be the part 2. So without any ado, I would like to welcome the guest speaker Dr. Naghman Zuberi. Assalamu alaikum sir, how are you?
Walaikum assalam. Alhamdulillah, I'm good and very sad to share this news that our teacher, our mentor, Dr. Masood Alam Shad passed away and just received this message. So may Allah raise his ranks in Jannah and give sabr to his family. That is a very sad and shocking news. Just like a couple of minutes ago, I just received this message and this news. Well, life continues, life goes on, and well, I'm here as per commitment. So let's start with the lecture now. And today we will be discussing part 2 of our lecture, which we started, the series of lecture which we started last Monday. So it will be second part, and then we are going to have third and the final part in the next lecture, the next Monday, inshallah, God willing and life permitting. So let's start now. Well, when we position the denture teeth, we do the anterior teeth setup and we do the posterior teeth setup. Well, there are certain anatomical landmarks or the aids which we use to position the denture teeth, especially the anterior ones. Well, posterior also requires certain landmarks and aids for the positioning of the teeth. First of all, the lip line. It is the highest point of upper lip when the patient is smiling. And the cervical necks, they should lie above that line. Very important point is, otherwise it will look very unaesthetic. Secondly, the teeth should not be occlusogingivally short in size. If they will be short in size, then again the aesthetics will be compromised. We also mark the corner of the mouth so that our canines should be placed according to these lines. If the midline is angled, teeth may be set so they do not look centered, like over here. Then the palatal midline. It is extended through the middle of the incisive papilla and the mid-palatal raphe. In this condition, we have to check for the symmetry. If our rims are not symmetrical, then we can adjust our rims before starting the setting up of the teeth. Then comes the canine references. We pass one line which I have already mentioned in the middle, and the other line is passed in such a way that it should be passing through the distal area of the incisive papilla, and it should be perpendicular to the palatal midline, and it must intersect the cusp tips where they were present. They were supposed to be present when the patient was dentate. So the lines through the incisive papilla and the midline raphe, it defines the midline of the denture teeth setup and should be scribed on the cast and record base. Incisive papilla, it guides us for the setting up of our anterior teeth. On average, facial of the central incisors are, some of the authors, they say 7 millimeter. Other authors, they say 8 millimeter to 10 millimeter anterior to this line. The anterior-posterior positioning of the anterior teeth is important for aesthetics and phonetics. They support the lips, cheeks, and other circumoral tissues. Anterior artificial teeth should be placed in the same position or as close as possible to that occupied by the natural teeth to maintain natural appearance of the patient. We transfer these lines from the land area to the occlusal rims and record bases to help in the symmetrical setup of the denture teeth. That's how the rims they will look. We have already discussed about these two lines. Then comes the lower denture. Retromolar pads is a very important anatomical landmark in the lower denture. The distal border of the lower denture is actually dictated by the retromolar pad. And a point 2/3 the way up the retromolar pads that is used to approximate the occlusal plane. Well, how to find the occlusal plane using the alar tragus line, we are going to discuss in our next lecture. At the end, how the interpupillary line, it is used for setting up of the anterior teeth. We will discuss it in the next lecture, inshallah. Center of the ridge for the posterior. Maxillary lingual cusps should be centered over this line. Mandibular teeth must be on the center of the ridge, ensures denture stability when the mandibular teeth are placed on the center of the ridge. It reduces fulcruming of the forces during function. Some of the authors and some of the forums, they say that mandibular teeth should be towards the buccal shelf area or towards the lingual area. That is not true. According to Zerb, according to some of the authenticated authorities, they should be centered on the center of the ridge. The posterior teeth are placed on the ridge crest, as I have already mentioned, especially the mandibular teeth. This position is important for the lower denture stability. If it is necessary to place the teeth outside the ridge crest, then that is done for the maxillary denture. At times we have to play to have the proper horizontal overjet. If that horizontal overjet is not present, then chances would be that patient is going to have cheek bite. So in order to achieve that proper horizontal overjet, if we have to play with the positioning of the denture teeth, then we play with the upper denture teeth, not with the lower denture teeth. Similarly, for the lower anterior, here we draw a line with a pencil and a straight edge on the cast extending out of the land area. If the anterior teeth are set too far anterior to this line, heavy fulcruming forces can cause tilting and dislodging of the mandibular denture, particularly when the mandibular ridge is severely resolved. So this is the line we have to set. This is the center of the ridge in the anterior region of mandibular. Here we have already discussed about the posterior. And this is the halfway up retromolar pad. This is the border. This border is actually dictated by the masseter muscle as well. The incisal edge of the central incisor and canine should be placed at the occlusal plane, while the lateral should be placed approximately 0.5 millimeter above the level of the occlusal plane. The cervical neck tilts more. If you remember, we have discussed about the positioning of the anterior teeth in our one of the lectures on occlusion, where I told you that the incisal edges are more mesial as compared to the cervical area, even in the natural dentition. And we maintain the same positioning in our artificial dentures as well. So the cervical neck tilts more posteriorly or distally at an angle as one moves from the central incisor to the canine. The greatest height of the free gingival margin is slightly distal to the mesiodistal center of the tooth. The anterior teeth are set mainly but not exclusively for phonetics and aesthetics. In denture occlusion, unlike the natural dentition, anterior contacts are avoided in centric position to minimize the forces over the anterior residual ridge, which resorbs more quickly under external pressure compared to the posterior ridge. In excursive movements, anterior teeth contact to permit the incising of the food, but we will discuss that there should be counteracting of the fulcrum, which will be there. How we do that in excursive movements, that the posterior teeth should be in contact as well in the artificial dentures, which is not in present, that intercuspation is not present in our natural dentition. I have discussed that point a couple of times with you, so you can see why and how it happens and what is the difference between the natural dentition and the artificial dentures when we talk about the compensatory curves and the curve of Spee. We will discuss it while we will be discussing about the balanced articulation in our next lecture, inshallah. Mandibular anterior teeth incline similar to the maxillary teeth, but the incisal edges are placed at a similar level to each other. So over here, it is not the case that since our lateral incisor in the maxilla is slightly higher, so we are not positioning it slightly higher. The incisal tip of all the anterior teeth, they should be at one level. So the mandibular anterior teeth are set even with the occlusal plane, no overbite for monoplane teeth, and lingualized occlusal schemes. Canines should be tilted more posteriorly at their cemento-enamel junction than other anterior teeth and should have a more prominent, if we look at the tilting, canines are tilted even more. And they should have a more prominent cervical neck. So if we look at the upper and lower anterior teeth setup, the dotted line through the incisal edge and cervical neck, you can see this is the central, this is the lateral, and this is the canine. And solid line is the perpendicular to the occlusal plane. You can see that. The facial surface of the central incisor is approximately perpendicular to the occlusal plane, the facial surface, while the neck of the lateral incisor is slightly depressed, and the neck of the canine is more prominent. For the mandibular central incisor is proclined more than the lateral incisor, which is fairly upright, and the canine has the most prominent neck. So that's how the anterior teeth are set. Now we will, in the next lecture, we will go step by step how we set up the teeth for anterior and posterior teeth, and then how we use the compensatory curve for achieving the balanced articulation. So we will meet next Monday, same time, and we will continue from here. And inshallah, we are going to finish the topic. And if any questions, any ambiguities, any queries, please feel free to call us, to tell us, or any objections or any points you want us to discuss in this regard in our next lecture. Please let us know and we will do that. Thank you very much, everyone, and see you next Monday.
Thanks a lot, sir. Khuda Hafiz.
Allah Hafiz. Assalamu alaikum.
Walaikum Assalam.